the amount of substance that is taken up. Okay, the amount of substance that is taken up divided by atriovenous difference of that substance. Got it? So with the Fick's principle, we are just substituting it and we are obtaining the blood flow. Now what substance will be taken up? Okay, we need not give any external substance. We need not give any external substance because हमारे पास एक substance है जिसका uptake हमको पता है, that is oxygen. So what we will do is we will just measure the cardiac output by knowing the oxygen consumption, which we already know it is 250 ml per minute. We will take a arterial sample and find out its oxygen content from any peripheral artery, and we will take a venous blood sample to find out the oxygen content in the venous blood. Usually it is taken from the pulmonary artery by placing a catheter into the through the heart. So you're going to put a catheter through your heart, reach it to the pulmonary artery to take up the venous blood sample, and from any peripheral artery you will take an arterial blood sample. So you can calculate the cardiac output is equal to oxygen consumption. Oxygen consumption, obviously it will be in ml per minute divided by arterial oxygen minus venous oxygen, right? This value. So we know that the arterial oxygen, okay, the arterial oxygen content is around 200 ml per liter, 200 ml per liter, and this is around 150 ml per liter, and oxygen consumption is 250. So 250 divided by 200 minus 150, which comes to 50, and so you're going to get as 5 liters per minute. 5 liters per minute, right? So if this comes as Fick's principle, sometimes comes as a short note to you. Now what is the advantage of this method? It is a quite accurate method. So the advantages is that it is a quite accurate method, and इसमें you are using the oxygen which is normally taken, so no chemical is being used. However, it has got certain disadvantages. How? You need to hospitalize the patient, isn't it? You require hospitalization because you have to do a catheterization. You have to put the catheter into the pulmonary artery and take a sample. That is a special technique. So there is a risk of this catheterization. There is a risk of catheterization. And sometimes what happens when you are subjecting a person to any kind of an operational or interventional procedure, you're doing a catheterization, you're putting up some, you are doing some intervention, right, or some interventional technique, this will result in anxiety, which itself may cause an increase in the cardiac output, right? So these are certain advantages and disadvantages of the methods with your cardiac output. Now let us consider the factors which are regulating cardiac output, or the factors which are affecting cardiac output. We will try to make it as simple as possible because this is a very important LAQ, and I don't want that at any point of time you should be confused. So up till now, what did we do? We considered certain normal values and definitions. We considered the methodology, and now we are going to have, after the physiological factors affecting cardiac output, how do you bring about the regulation of cardiac output? Regulation of cardiac output. Now we know that cardiac output is equal to heart rate into stroke volume. ठीक है? Heart rate into stroke volume. heart rate is controlled mainly by the autonomic nervous system, and there are various hormones and there are various reflexes which can regulate your heart rate. So autonomic nervous system mein you know that the sympathetics, they increase the heart rate, and the parasympathetics, they decrease the heart rate. Vagus is maintaining your vagal tone, decreasing the heart rate. Hormones like adrenaline, okay, adrenaline, then your thyroid hormones, you can remember catecholamines, adrenaline, noradrenaline, they are catecholamines, your thyroid hormones. Then there are vasal reflexes, the volume reflex, then there is Cushing reflex, which we will study with cardiovascular regulation, which are affecting your heart rate. Okay, now stroke volume regulation is very, very important. So I just tell you one term, and that is a point which is to be considered in detail. Now the stroke volume can be controlled by different ways. It is called preload, afterload, and it is also called as the state of contractility of the heart. So one way by which you control your stroke volume is your preload. I think you must know this term preload because you've completed your nerve muscle physiology. So it is the load acting on the heart or acting on any excitable tissue before it starts contracting. So you are hanging some weight before the muscle is getting contracted. That means the load is acting on the muscle before the muscle begins to contract, right? The load acting on the muscle before the muscle begins to contract, that is what is preload. So when you speak about preload, what do you change? You change the length, है ना? You increase the length, you increase the initial length. So यहाँ पर what is the preload is venous return. What is the preload? It is venous return or the end diastolic volume. So when you are bringing about a change in the length, so length in the case of heart is venous return, right? In the case of heart, the length or the preload, it refers to the venous return or the end diastolic volume. So you are increasing the cardiac output by bringing some changes in the length of the heart. That means a change in the volume of the heart. So this is also called as heterometric regulation. Heterometric regulation. So hetero means change, metric is pertaining to length. So it is heterometric regulation. This is based upon the Frank-Starling's law of heart or the Frank-Starling's law. This we will write down. Okay, this we will write down. Just understand. So the first factor by which you can affect or change the heart, affect or change the stroke volume, and therefore the cardiac output, is heterometric regulation, where you bring about a change in the length, that is venous return. The second way is affecting the force of contraction of the heart, that is the inotropy or the inotropic state of the heart. So you are not bringing about any change in the length of the heart. The length of the heart is same. You are not causing any change in the length of the heart. You are only bringing about a change in the force of contraction or the inotropy. This is also called as a homometric regulation of stroke volume. Homo means same, metric length. तो यहाँ पर you are not bringing about any change in the length of the heart. ठीक है? You are only going to bring about an increase or decrease in the force of contraction and affect the stroke volume and thereby affect the heart rate. Thereby affect the cardiac output. The third factor, the third very important factor that affects the stroke volume is afterload. How do you define afterload in skeletal muscle? It is the load after the muscle begins to contract, isn't it? So यहाँ पर afterload होता है the resistance against which the resistance against which the ventricles have to pump the blood. The resistance against which the ventricles have to pump the blood. Okay, the resistance against which the ventricles have to pump the blood, that is afterload. Now we will consider each of these factors one by one. Okay, so heart rate का जो regulation है, hormones है, reflexes है, and autonomic nervous system, they will be covered very nicely. And when actually we also consider the cardiovascular regulation, उस समय the reflexes we will take along with that. Now what is venous return? So now we are considering the first factor, that is the heterometric regulation, that is the end diastolic volume or the venous return. Now, what is this venous return? It is the amount of blood volume that returns to the right atrium through systemic circulation. Okay, it is the amount of blood volume that returns to the right atrium from systemic venous circulation, and this venous return, it depends upon many factors. Okay, so there are many factors on which this venous return depends upon. These are skeletal muscle pump, thoracic pump, which we will elaborate. Okay, just write down, because आपको आंसर लिखना भी आना चाहिए. Sometimes you understand but you don't know how to write, and unless until you write well, जब तक आप अच्छे से लिखोगे नहीं तो आपको कितना भी समझ में आया, you won't get marks. At the end of the day, what is needed is marks, because you have to marks out with good, you need good percentage. So skeletal muscle pump, then the thoracic pump, then the abdominal pump, then you have got your ECF volume, then you have got sympathetic nervous system. Okay, then you also have got the posture. The effect of posture is very, very important. Then it also depends upon if there is any resistance to flow of blood in venous return or in the venous system. Resistance to blood flow in the venous system, right? Resistance to the blood flow in the venous system. Now only heterometric regulation can be a question. So if it is heterometric regulation, what will you write? That the cardiac output is affected by heart rate and stroke volume. When there is an increase or decrease in the stroke volume by bringing about a change in the length of the cardiac muscle fibers, it is referred to as the heterometric regulation, which is based upon the Frank-Starling's law. So the first thing which we need to write is the Frank-Starling's law. So what is this Frank-Starling's law? This law states that within physiological limits, okay, within physiological limits, the force of contraction of heart, okay, the force I'll make heart red. so that आपको ध्यान में रहेगा कि वो हार्ट है. The force of contraction of the heart, the force of contraction of the heart is directly proportional to the initial length. It is directly proportional to the initial length of the cardiac muscle fibers. Right? Within physiological limits, the force of contraction of the heart is directly proportional to the initial length of the cardiac muscle fibers. Now, what is this initial length? So, it is the length of the cardiac muscle fibers just prior to contraction. Just prior to contraction, just before they begin to contract. Contract होने के just पहले is the initial length, just prior to cardiac contraction, right? So this initial length is what? It is actually what? It is actually the venous return. It is actually the end diastolic volume. मतलब जब ventricles blood से fill हो गए, उसके बाद they start contracting. वो जितना फिल हुए, दैट मीन्स 120 to 130 ml, अगर हमने इसको 150 ml कर दिया, that means if we are increasing the end diastolic volume, that will cause the stretching of the cardiac muscle fibers. And अगर muscle fiber या excitable tissue को आप थोड़ा सा stretch करके रखेंगे पहले से ही, the force of contraction is more. This is what is the principle. Why are you adding the word within physiological limits is to be understood. ये आप क्यों ऐड कर रहे हैं? मान लो आपने हार्ट को जो एंड डायस्टोलिक वॉल्यूम है उसको 200, 250, 300 ml कर दिया. इसमें क्या होगा? The heart is not getting stretched, it is getting dilated. इतना बड़ा हो जा रहा है वो because of that dilatation that it is not able to develop the force of contraction. उसमें कुछ फायदा होगा नहीं, right? So there should be a limit. The reason is that you have already studied that the heart also follows the length tension relationship, right? That means an optimum tension will be developed by the cardiac muscle fibers and optimum tension will be developed by the cardiac muscle fibers only at a particular length of sarcomere. So अगर sarcomere की length is optimum, तो आपको याद है क्या होता है? There is maximum overlapping of the actin and myosin. अगर आपने length बहुत कम कर दी, actin will overlap over actin. अगर आपने length बहुत बढ़ा दी, okay, sarcomere का length आपने बहुत बढ़ा दिया, so the actin and myosin they will go far apart from each other. इसीलिए हम ये term use करते हैं within physiological limits. That means जो sarcomere का length है वो optimum होना चाहिए so that there is maximum overlapping of actin with myosin that will produce optimum tension or the force of contraction, right? So this is the Frank-Starling's law and this is also my 2 marks BAQ. तो चलो अभी वापस से रिवाइज करो हम कहाँ थे, अदरवाइज बिल्कुल भूल जाएंगे. सो हमने देखा कि कार्डियक आउटपुट इज इक्वल टू हार्ट रेट इनटू स्ट्रोक वॉल्यूम. ठीक है, सो हमने देखा इट इज हार्ट रेट इनटू स्ट्रोक वॉल्यूम. स्ट्रोक वॉल्यूम को वी कैन रेगुलेट बाय 3 वेज. वन वाज आर प्रीलोड जो अभी हम पढ़ रहे हैं जिसको हम बोल रहे हैं हेट्रोमेट्रिक, देन फोर्स ऑफ कॉन्ट्रैक्शन एंड आफ्टर लोड. सो नाउ वी आर स्टडिंग द हेट्रोमेट्रिक रेगुलेशन which is depending upon the venous return, and these are the various factors which are going to affect the venous return which we will have to study. Now, what is one more important thing to be known? Remember that venous return is equal to something which is this, which I'll tell you, don't worry about it at all. What is this? Venous return is equal to PSF, which is called as mean systemic filling pressure. Mean systemic filling pressure, right? That is normally around 7 mm Hg. And right atrial pressure, RA is the right atrial pressure, and RVA is the resistance to venous return. Resistance to venous return. इसका मतलब आपको दिख रहा है कि venous return is directly proportional to this pressure delta P, PSF minus RA, and inversely proportional to resistance. So in any condition when there is an increase in the resistance to the venous return, okay, whenever there is an increase in the resistance to the venous return, what will happen? The venous return will decrease. And delta P, this is also called as delta P. This word delta P we will also study with hemodynamics. ठीक है? Delta P में this is the mean systemic filling pressure, this is the right atrial pressure, and the mean systemic filling pressure will always be more than the right atrial pressure. तभी तो blood will flow towards the right atrium, है ना? अगर right atrial pressure बहुत बढ़ गया, normally the right atrial pressure is just between 2 to 3 mm Hg, सिर्फ इतना होता है. और अगर right atrial pressure बहुत बढ़ गया तो what will happen? अगर वो mean systemic filling pressure से ज़्यादा बढ़ गया तो what will happen? The blood will not flow towards the right atrium. So the mean systemic filling pressure is always more than the right atrial pressure. Now this mean systemic filling pressure is actually, theoretically it can be measured everywhere in the systemic circulation. Suppose the entire blood flow in the vascular tree, हमारा vascular tree में the entire blood flow in the vascular tree is temporarily stopped. For example, artificially you are producing some electric shock, and पूरा का पूरा जो circulation है, it comes to a standstill. Okay, so the entire circulation is coming to a standstill. At that point, there will be an equilibrated pressure, same pressure in the entire circulation. That is what is the mean systemic filling pressure. So when in any condition where the entire circulation is coming at a halt, there is an equilibrated pressure throughout the circulation. That is what is the mean systemic filling pressure. Okay, so this mean systemic filling pressure is always more than the pressure of the right atrium, and the blood always flows towards the right atrium, right? So this is a desirable thing to be known. That venous return is equal to mean systemic filling pressure minus right atrial pressure divided by resistance to venous return. Right? Now, when can be this resistance to venous return take place? Normally, resistance जो होता है ना, it is usually more with the arteries than with the veins. Okay? So, whenever there is a resistance, अगर बढ़ गया, venous resistance बढ़ गया, suppose there is venous obstruction. Okay, suppose there is venous obstruction, but the veins are quite distensible. Their resistance does not increase. But when there is an increase in the resistance in the arterioles and in the smaller arteries, the blood will accumulate. And that time that resistance will decrease the flow of blood to the heart. Okay, so whenever there is an increase in the resistance to the flow of blood, the venous return will decrease. But remember, the main seat of resistance is not the veins, it is the arteries, the small arteries and the arterioles, which you will study when we consider the different types of blood vessels. Now let us see the different factors by which you are going to affect your venous return. जैसे हमने रेस्पिरेटरी पंप लिया, एब्डोमिनल पंप लिया, वो सब. Now, what is respiratory pump? Okay, what is respiratory pump? जैसे muscle pump, respiratory pump. So we will see all this one by one. Now, respiratory pump, also called as the thoracic pump, especially this will work when there is deep inspiration. Now, suppose there is a deep inspiration. What will happen with especially a deep inspiration? There is going to be increase in the venous return to heart. Why does this take place? This is what is the respiratory pump, that with deep inspiration there is an increase in the venous return to the heart, and that is what is the respiratory pump. Because with deep inspiration the intrathoracic pressure becomes more negative. The intrathoracic pressure becomes more negative, right? Because with deep inspiration what happens is a thoracic expansion, right? And the central venous pressure falls. So with deep inspiration the blood is withdrawn more towards the heart due to expansion, and the intrathoracic pressure becomes more negative. Now, what is this abdominal pump? What is this abdominal pump? Again, consider when the person is taking a deep inspiration. Okay, when the person is taking a deep inspiration, there is going to be descent of diaphragm. What is diaphragm? It is the main muscle of inspiration. So there is a descent in diaphragm. So with descent of diaphragm जब नीचे आ जाएगा, there is going to be an increase in the intra-abdominal pressure. Increase in the intra-abdominal pressure. So as this intra-abdominal pressure rises because of the descent in the diaphragm, it causes the compression of the, or it compresses the intra-abdominal blood vessels. Intra-abdominal blood vessels, and again the blood is going to be pushed towards heart. So this is what is the thoracic pump and the abdominal pump, and both of them they work more when there is inspiration. Now, what is the role of the ECF volume? In any condition, whenever there is an increase in the ECF volume, obviously there is going to be increase in cardiac output. A very common condition is pregnancy, where there is lots of hemodilution. Okay, there is lots of hemodilution and there is increase in the cardiac output. Or if there is a decrease in the ECF volume, for example, the patient is having lots of vomiting, there is diarrhea, or even there is a profuse sweating. You are standing in hot sun, you are exercising, you are not taking water, profuse sweating, and you just feel like a fainting attack. This itself can cause a decrease in the cardiac output. So volume, it affects a lot when you consider this. Then the next important factor which we considered was the skeletal muscle pump. The skeletal muscle pump, and this is especially your calf muscles. Especially your calf muscles. Now you know that the veins, they have got valves in them, and this is especially even the veins of the thighs, the calf muscles and the foot, they all have got valves. But सबसे important जो हमें काम आते हैं वो होते हैं calf muscles में जो veins हैं. Or if you look into this ना, like suppose if this is the skeletal, I just draw a muscle. Now suppose this is a muscle like this. Okay, this is a muscle, and the muscle will have blood vessels. Okay, so it will have blood vessels and there will be valves in it. So there is going to be a proximal valve like this, and there is going to be another valve which will be a distal valve. Distal valve. So this is going to be the proximal valve and this is going to be the distal valve. And the very important peculiarity is that these valves, they open towards heart. Okay, the valves open only towards heart. The valves, they open only towards heart. So as they as they open towards heart, they're going to take the blood flow to the heart. So any activity when you are increasing in the skeletal muscle, for example, even when you are doing a simple walk, or there is jumping, right? Any kind of exercises where you are causing the skeletal muscle to contract. So when the skeletal muscles will contract, what will happen? They will compress the veins. As they compress the veins, the blood will be always it will always flow towards heart, because what happens is that this is the blood flow, the proximal valves will open, right? These proximal valves, they will open, but the distal valves will close, and this is going to be the flow of the blood always towards the heart. ठीक है, ऑलवेज टुवर्ड्स द हार्ट. सो ब्लड ऊपर की तरफ जाएगा, बिकॉज जैसे ही ब्लड ऊपर जाएगा थ्रू द प्रॉक्सिमल वाल्व्स, द डिस्टल वाल्व्स विल क्लोज. सो one of the very important thing, if any person you find has got a fainting attack, क्या करना चाहिए? पेशेंट को सुपाइन लिटा दो. जैसे आपने सुपाइन लिटाया, the venous return to the blood will increase, to the heart will increase. Just elevate the legs. When you elevate the legs, again the venous return will increase, and massage the skeletal muscles of the calf, है ना? So जैसे आपने skeletal muscles की calf muscles को थोड़ा massage किया, you are stimulating this activity which we call as the skeletal muscle pump, and you are increasing the venous return to the heart, right? Then sympathetic activity, the role of the sympathetic is not only on the heart, it is also on the blood vessels, and it will be studied in detail with cardiovascular regulation, where you will see that the sympathetics, they cause an increase in the cardiac output, venous return, stroke volume, they cause increase in the heart rate, they cause increase in the blood pressure, they cause increase in the force of contraction, everything, right? Now what is the effect of posture? A lying posture is going to increase the venous return to the heart. Lying posture, ठीक है, आपने जब लिटाया हुआ है. standing में क्या होगा? There is going to be the venous pooling of the blood in the veins, or in the veins of the lower limbs, right? There is going to be the venous pooling of the blood in the veins of the lower limbs, and what will happen is that there is going to be a decrease in the venous return, and whenever there is decrease in the venous return, there will be decrease in the cardiac output, right? So deep inspiration, posture, sympathetics, ECF volume, all these are going to affect your heterometric regulation of the stroke volume, and this heterometric regulation of the stroke volume is how regulating your cardiac output. ठीक है. Now we consider the what we called as the homometric regulation, that is myocardial contractility. How the myocardial contractility, which we also called as homometric regulation. So any condition which is going to increase the force of contraction will increase the stroke volume, will increase the cardiac output. So यहाँ पर you are not increasing or decreasing the amount of blood volume. That means यहाँ पर you are not bringing about any change in the length. So this is not working on the Frank-Starling's law. यहाँ पर you are only concentrating on the force of contraction. So whenever there are different factors. So increase in the force of contraction, okay, the factors that increase the myocardial contractility. Myocardial contractility, and therefore they increase the stroke volume and therefore they increase the cardiac output. They are said to be positively inotropic factors. Positively inotropic factors. Right? Positively inotropic factors. Which could be the positive inotropic factors? Very, very important, or the first important one is directly the effect of sympathetic stimulation. Second, catecholamines. Then thyroxine. Then xanthine. Another, digitalis. Digitalis is a pharmacological drug, okay, which is given to the patients with cardiac failure because it is a positive inotropic agent. Then those factors which decrease the force of contraction, therefore decrease the stroke volume and therefore decrease the cardiac output are negatively inotropic agents or factors. Negatively inotropic factors. So negatively inotropic factors, the negative inotropic factors are usually those factors which are not allowing the ventricular compliance, which are affecting the ventricular compliance. So any factor which is decreasing or which is increasing the stiffness in the ventricles, okay, which is increasing the stiffness in the ventricles or causing a poor ventricular compliance are the negative inotropic factors. For example, there is increase in the parasympathetic activity, or you bring about a decrease in the sympathetic activity. Conditions like hypoxia, decreased oxygen at tissue level, hypercapnia, excess of exposure to CO2, then even acidosis, right? Myocard infarction, where you are decreasing the compliance of the drug, compliance of the heart, are the negative inotropic factors which are going to decrease the heart rate, decrease the force of contraction. Now, what is the third factor? If you remember, the third factor was afterload. Okay, the third factor was afterload. So, what is afterload? It is the load against which the ventricles pump. It is the load against which the ventricles pump. Now remember, we are bothered more with the left ventricle than with the right, because it is the left ventricle which is giving the blood to the periphery, okay, or to the entire body. So we are more considered or more bothered with the left ventricle. So in the case of this, it is the total peripheral resistance. Okay, it is the total peripheral resistance. Okay, now you remember one thing, that what did we learn, that when the left ventricular pressure becomes more than the aorta, the valves open and the blood is ejected. You remember that, isn't it? Now suppose there is stenosis of the aorta, aortic valve, aortic stenosis, or if there is an increase in the mean blood pressure. What will happen if there is an increase in the mean blood pressure? Right? The pressure of the aorta is increased from normal 120 by 80. It is increased to about 150 by 100. So ventricles को भी उतना pressure बढ़ाना पड़ेगा, है ना? उतना pressure बढ़ाना पड़ेगा उनको, and then they will be able to open the valves, because the ventricular pressure should be more than the pressure of the aorta. Then only the valves will open. So remember that with increase in the preload, obviously within physiological